IVM.
Now you've got these studies, you figured out that there is something that's an issue. What are the possible lines of treatment for sleep apnea?
Very nice. So I would say the gold standard still today is a CPAP machine. CPAP, it's a mask that you put on your nose and mouth, and it will keep giving air under pressure so that your airway remains open. That's why it's called continuous positive airway pressure device, CPAP. However, it's very good for people who are old because the problem there is muscle relaxation. It's very good for people who are very obese because the problem is in the requirement of air, because if you're obese you require more air. But it's not great for young people. It's not great for people who are not obese, because there the problem is not the hunger for air. The problem is in the passage.
Right.
So we have to understand the difference between the two conditions. One is the global problem. If you're very obese, your requirement for air is more, so you supplement air. In the other person who is young and whose airway is blocked, then you have to figure out where is the blockage and you remove that blockage.
Correct.
That's a more logical solution. So these are the two major streams in treatment of the sleep apnea spectrum.
Can we talk about CPAP machines a little bit?
Yes.
So there are different kinds. So when I'm working with my clients, many of my clients have sleep apnea, like I was telling you before the podcast. And some of them have a full mask that they have. Some of them just have their nose that is being
Nasal
covered.
pillows.
What is the difference between these different kinds of masks? When would you use one versus another?
So this becomes a little specialized subject, but as I said, God has made nose to breathe. So the most logical solution is to breathe through the nose. If your nose, if you have to choose a mask, the nasal pillow, the nasal mask is going to be most easy for a person to adopt.
Correct.
But some people have a nose block. So obviously the pressure in the nose will be very high and still they need a help. Or some people are unable to do well with the nasal mask only, and the pressure required is high. So you put a full face mask. But naturally, a full face mask is not very easy to tolerate. The nasal mask is much, much more easier to tolerate. Then there's something called continuous pressure CPAP, continuous positive airway pressure. Then something called automatic pressure,
Okay.
APAP, automatic CPAP. Something called bi-level PAP. I'll not get into the details of that. That let your doctor decide. If you require a CPAP, let your doctor decide.
Right.
But this is how CPAP actually works. Then I said CPAP, figuring out where the problem and tackling it by surgery. Or there's something called dental devices where your jaw is collapsing. So they put a dental device in your mouth, which
push
keeps
in the
your
front.
mandible advanced in the night. It's not very common in our country as of now. But in the Western world, almost every dental clinic makes dental devices. It's very, very common.
Interesting.
And so for mild sleep apnea, you just put a dental device
Yeah.
and it will advance your mandible, so it will not let your tongue and the soft palate collapse backwards. So these are the three major ways.
I remember
it's
7 years
treated.
ago going to my dentist and saying, you get these devices that you push your jaw in the front through the
Correct.
night so it helps you breathe better. And he
Correct.
looked at me like I was mad.
Absolutely.
And he was like, what are you talking about?
So
Like,
7
why
years
do you-
back, though, in our country, nobody knew about it.
Yeah.
Now the awareness is good, but still the number of dentists actively practicing this device is almost negligible.
Like from my earlier question, like I don't have sleep apnea, I don't snore, but I was looking at trying to optimize my breathing through the night. Is this like dental device something that you would suggest to optimize your breathing? Or if you don't have it, why bother? What would be your connect?
First thing is to look at your nose. As I said again, God has made nose for breathing. Only if the nose is not perfect, then your mouth will chip in. Otherwise, if the nose is perfect, why should the mouth has to work?
Right.
So first thing is evaluation of the nose.
So the nose is the key part.
Key part.
Right. So we were in the middle of talking about the devices. So the second one was the dental device.
Then comes a surgical solution, because most of the young people, there was a study which was done in Italy some around 12 years back. They saw that the incidence of sleep apnea rises very sharply till the age of 60, and then suddenly at the age of 65, 70, drops very suddenly, almost vanishes.
Wow.
So it was looked into why it can happen. If somebody has developed sleep apnea, why at the age of 70 there's nobody having sleep apnea? It was done by my professor Claudio Vicini in Italy. He talks about it. I really do not know who had done that study, but then he said that they went into the details of everybody and found out that all those people had sleep apnea had actually died before the age of 70.
Oh, yo. Okay. It has a dramatic plot twist.
Yeah.
Okay.
So it decreases your life expectancy
So dramatically.
So dramatically.
Wow. Okay, so we've discussed sleep apnea. We've discussed the dental device that is there. What is the next thing that you would have to progress through?
Yeah, so as I talked earlier, that most of the young people need to be treated so that they do not develop into severe sleep apnea. And for them to understand where is the problem, where is the obstruction. It's obstructive sleep apnea, right? Very, very few people have central sleep apnea where the brain is not working. Here, there's an obstruction which is leading to sleep apnea. So if there's an obstruction on the road, what do?
Go around it.
Going around is the CPAP. Absolutely correct. Going around is the CPAP. What is the best measure?
You come and take off the obstruction.
You come and take off the obstruction. That's the best measure. So how do you do it? First, you identify where is the obstruction, and then you treat it, remove the obstruction. So there are two types of obstruction, static and dynamic. I'm not talking from any scientific language. Static or dynamic, everybody can
Something's
understand.
Moving or something's staying.
Absolutely. So if your nose bone is crooked, if you have got sinus, if you've got turbinate hypertrophy, it is there throughout the day and also in the night. So this can be identified easily when you're sitting in the clinic, when you're on the CT scan machine. Even if you're awake, still there's an obstruction. That's called static obstruction. And any ENT surgeon can actually deal with it. Your neighborhood ENT surgeon can very well do a septoplasty and turbinoplasty and kind of things and deal with it. Now comes...
Are these big surgeries?
No, they are not big surgeries. Very, very common.
Okay.
Septoplasty surgery is happening last 100 years or more. Any ENT surgeon is trained to perform a septal surgery. Fine. How is it is executed, how well it is executed will depend on the ability of the surgeon.
Of course.
Now, dynamic obstruction. So something which happens only during sleep when you are sleeping. This does not happen when I'm talking to you, but this happens when I'm sleeping. So to understand where is the problem while you are sleeping, we have to recreate sleep. So we have to make you go off to sleep. That can be done in the operating room with a sedation, where the anesthetist would, take the person under anesthesia, not anesthesia, sedation, make him snore, make him choke, and then we put a camera and figure out where is the obstruction. That's called drug-induced sleep endoscopy.
Right.
See, in our country, we started this around 2010, as I said. But it was started in 1991 in the UK. So from then, it has come a long way and has become standardized in the last 33 years. So drug-induced sleep endoscopy, why it's called drug-induced? Because we give a medicine to the person to go off to sleep, and then we do a endoscopy during sleep. So therefore, we call it drug-induced sleep endoscopy.
Right.
It's a pretty standard test across the globe now. And by doing that, we figure out whether your tonsils are contracting, whether your soft palate is collapsing, whether your tongue is collapsing, or the epiglottis, as I talked about that gentleman. So where is the problem? And then you fix that problem. Earlier, the throat surgery was considered very, very risky, and therefore it was not done. But since we introduced coblation, the plasma surgeries in our country, I think in 2007-8, and then the robot in 2012, all these surgeries have become quite simple, and dependable. There's no bleeding, pain is very less, minimally invasive surgeries. So by this, you permanently remove the obstruction which is there. Like I have my own technique of using barbed suture called suspension bridge palatopharyngoplasty. It's a published technique by which we put sutures across the soft palate. This sound is getting produced by the soft palate because the soft palate is vibrating.
That's
vibrating. So we put a suture in the soft palate,
Right.
Barbed suture, which does not let the soft palate to vibrate and the snoring goes away. So earlier you had to chop off the soft palate. Now you can just put
just braced it.
Absolutely, bridged it on two sides so that it cannot collapse anymore. So things have evolved, and therefore now even people who are having simple snoring, and even if their own health is not at stake, but their spouses are,
About
the
to complain. Huh?
Yes.
Marital issues are about to begin.
Yeah, in our country, the divorce is not so common on this ground. In Western countries, it's so common to
On
get divorced
snoring?
on snoring. Yeah,
Wow.
yeah. I'm unable to sleep because of my husband, so I want divorce.
Amazing. Right. So prevent legal issues as well from
As
happening
well,
in the future.
and if somebody, and obviously you will not develop sleep apnea if you treat snoring in time. So obviously,
Okay, so if you enjoyed this episode, I want you to do two things. The first is make sure you send it to 3 friends so that they can enrich their life as well. The second thing I want you to do is I want you to subscribe so you know when future videos and podcasts come out. Now, if you want to follow us, we are at IVM Podcasts on Instagram, Twitter, etc. If you want to follow me, I am at Ashdin Doc on Instagram, Twitter, and everywhere else. You can also check out my books. They're available everywhere. Change Your Habits, Change Your Life, The Book of Good Habits for Kids, and One Habit a Day. Check them out now.
IVM.